Cotonou, the capital city of Benin in West Africa. Statistically, more than 1 in every 100 people you see here are living with HIV. The United Nations estimates that almost 70,000 people in Benin carry the virus, and that 5,000 of those are children, most of whom will have contracted HIV from their mothers. Preventing the spread of HIV among the general population is, of course, an essential goal. But only by preventing mother-to-child transmission of HIV can we ever hope to achieve an AIDS-free generation. That's why maternity clinics, such as this one in Cotonou, are focused on sensitively encouraging all pregnant women to be tested for HIV. Many women are afraid of being tested because a positive result too often means at best being stigmatized and at worst being ostracized, cast out of their homes and their communities. And yet a mother living with HIV can almost certainly give birth to and nurture a child who can expect to live without HIV, so long as the treatment starts in the earliest stages of pregnancy, ideally even before conception, and so long as the appropriate procedures are followed all the way through birth and infancy. Breastfeeding, for example, can transmit HIV, yet many mothers don't want to raise suspicion by being seen to bottle feed, even if they could afford the formula and access clean water. But with the appropriate drugs, the risk of breastfeeding can be greatly reduced. Carla Bruni-Sarkozy is the Global Fund's Global Ambassador for protecting mothers and children against AIDS. France's First Lady travelled to Benin to draw the world's attention to the fact that with the right resources and the right commitment, mother-to-child transmission of HIV can and should be virtually eliminated by 2015.
Les visites comme celle-ci.
And it's about assessment, she says, to evaluate the work being done locally with the support of the Global Fund. This is the village of Dangbo, just an hour's drive, but almost a world away from the bustle of the capital. It's home to one of the hospitals that now has the resources to implement the government's policy of making mother-to-child HIV prevention and treatment a priority throughout the country. Carla Bruni-Sarkozy, accompanied by Melinda Gates, who co-chairs the Gates Foundation with her husband Bill Gates, the founder of Microsoft, paid a visit. For many women, this hospital's maternity wing will be their first ever encounter with a medical doctor. It's an opportunity to advise them that an HIV test, even if positive, is the starting point for a longer and healthier life for both mother and child. Discovering the condition early and maintaining the most appropriate treatment means the child has every chance of entering the world without HIV, and that he or she will have a mother fit and strong enough to provide the maternal care that every child needs. Women come here not just from the local villages, but from tens of kilometers away. Why from so far? Not just because this place offers free treatment and sound counselling, but because it's a safe distance from the suspicions of friends, neighbours, and above all family, even their own husbands. Here they feel safe, they know they're in good hands. Because of the stigma, only a handful of women agreed to be subjected to the glare of the global media in the maternity ward. But they wanted other women in their situation to know that living with HIV is manageable. In the hospital's hot and crowded general ward, mothers and their children were too sick to be shy of the camera. Many of the women in this ward are living with HIV without knowing it and without wanting to know. But many of them will go on to bear more children, kids who could enjoy HIV-free lives and a healthy mother if only diagnosis and treatment could start at the earliest opportunity. Back outside, under the shade of a cluster of trees, past and present patients of the hospital have gathered, many with their babies, to meet these two very different women who've flown in briefly from far away. Most of them don't know who Carla and Melinda are, where they're from, or why they're here. A senior doctor tries to explain.
La visite de l'ambassadrice d'abord est un stimulus pour nous-mêmes.
The ambassador's visit motivates us, she says. And it's an opportunity to show her what we've already achieved with the resources given to us by the Global Fund, and to help the ambassador plead our case to get more resources.
D'utiliser ces résultats pour pouvoir faire un plaidoyer et obtenir des ressources complémentaires.
Clearly moved by their visit, Carla Bruni-Sarkozy and Melinda Gates bid each other and their hosts farewell and head home with a message of hope.